Hi friends, I welcome you all here at TNV Academy. In this session, we are going to talk about an international standard ISO 13485 2016. Now, let me talk about Clause 7, Product Realization. Let us discuss the Clause 7.3 Design and Development of ISO 13485 2016. The subclause 7.3.1 General states that the organization is required to document procedures for design and development. The subclause 7.3.2 Design and Development Planning says that the organization is required to plan and control the design and development of the product. As appropriate, design and development planning documents are required to be maintained and updated by organizations as the design and development progresses. During design and development planning, the organization is required to document the following: the design and development stages, the review or reviews needed at each design and development stage, the verification, validation, and design transfer activities that are appropriate at each design and development stage, the responsibilities and authorities for design and development, the methods to ensure traceability of design and development outputs to design and development inputs, and the resources needed, including necessary competence of personnel. Let's talk about subclause 7.3.3 Design and Development Inputs. This subclause says that inputs relating to product requirements are required to be determined and records maintained. These inputs are required to include functional, performance, usability, and safety requirements according to the intended use, applicable regulatory requirements and standards, applicable output of risk management, as appropriate information derived from previous similar designs, and other requirements essential for design and development of the product and processes. As per subclause 7.3.3, organization is required to review these inputs for adequacy and approved. As per this clause, requirements are required to be completed, ambiguous, able to be verified or validated, and not in conflict with each other. At last, this subclause guides to refer IEC 62366-1 for more information. Coming to the subclause 7.3.4 Design and Development Outputs. As per this subclause, design and development outputs are required to meet the input requirements for design and development. Design and development outputs are required to provide appropriate information for purchasing, production, and service provision. According to this subclause 7.3.4, outputs are required to contain or reference product acceptance criteria. As per this clause, design and development outputs are required to specify the characteristics of the product that are essential for its safe and proper use. The outputs of design and development are also required to be in a form suitable for verification against the design and development inputs and shall be approved prior to release. Covering the mandatory documentation requirements, subclause 7.3.4 states that records of the design and development outputs are required to be maintained by organization. Let's start with subclause 7.3.5 Design and Development Review. This subclause 7.3.5 states that at suitable stages, systematic reviews of design and development is required to be performed in accordance with planned and documented arrangements to evaluate the ability of the results of design and development to meet requirements. As per this clause, design and development is required to be performed in accordance with planned and documented arrangements to identify and propose necessary actions. Subclause says that participants in such reviews are required to include representatives of functions concerned with the design and development stage being reviewed, as well as other specialist personnel are also required to be included. This subclause 7.3.5 specifies that the organization is required to maintain records of the results of the reviews and any necessary actions. Records must also include the identification of the design under review, the participants involved, and the date of the review. Now coming to the subclause 7.3.6, Design and Development Verification. This subclause 7.3.6 of ISO 13485-2016 states that the design and development verification is required to be performed in accordance with planned and documented arrangements to ensure that the design and development outputs have met the design and development input requirements. As per this subclause, the organization is required to document verification plans including methods, acceptance criteria, and as appropriate, statistical techniques with rationale for sample size. Clause further specifies that verification is required to include confirmation that the design outputs meet design inputs when so connected or interfaced. If the intended use requires that the medical device is to be connected to other medical devices or have an interface with them. Subclause 7.3.6 says that an organization is required to maintain the records of the results and conclusions of the verification and necessary actions. Let's discuss now the subclause 7.3.7, Design and Development Validation. According to this subclause, 7.3.7 of ISO 13485-2016, the design and development validation is required to be performed in accordance with planned and documented arrangements to ensure that the resulting product is capable of meeting the requirements for the specified application or intended use. The organization is required to document validation plans that include methods, acceptance criteria, and, as appropriate, statistical techniques with rationale for sample size. The subclause 7.3.7 states that design validation is required to be conducted on representative product. Representative product includes initial production units, batches, or their equivalents. As per clause, the rationale for the choice of product used for validation are required to be recorded. The clause 7.3.7 specifies that as part of design and development validation, the organization is required to perform clinical evaluations or performance evaluations of the medical device in accordance with applicable regulatory requirements. A medical device used for clinical evaluation or performance evaluation is not considered to be released for use to the customer. If the intended use requires that the medical device be connected to or have an interface with other medical devices, validation is required to include confirmation that the requirements for the specified application or intended use have been met when so connected or interfaced. Clause states that validation is required to be completed prior to release for use of the product to the customer. Lastly, subclause 7.3.7 says that organization is required to maintain the records of the results and conclusion of validation and necessary actions. Let's talk about subclause 7.3.8, Design and Development Transfer. This subclause 7.3.8 of ISO 13485 says that the organization is required to document procedures for transfer of design and development outputs to manufacturing. These procedures are required to ensure that the design and development outputs are verified as suitable for manufacturing before becoming final production specifications, and that production capability can meet product requirements. This clause also states that results and conclusions of the transfer are required to be recorded by the organization. Now, coming to Subclass 7.3.9, Control of Design and Development Changes. Subclause 7.3.9 specifies that the organization is required to document procedures to control design and development changes. The organization is required to determine the significance of the change to function, performance, usability, safety, and applicable regulatory requirements for the medical device and its intended use. As per this subclause, design and development changes are required to be identified. Before implementation, the changes are required to be reviewed, verified, validated as appropriate and approved by organization. According to this clause 7.3.9, the review of design and development changes are required to include evaluation of the effect of the changes on constituent parts and product in process or already delivered. The review of design and development changes are also required to include inputs or outputs of risk management and product realization processes. Further, the clause 7.3.9 states that records of changes, their review, and any necessary actions are required to be maintained by organization to meet the requirements of the standard. Now, let's talk about subclause 7.3.10 of the ISO 13485-2016, that is, Design and Development Files. Subclause 7.3.10 specifies that the organization is required to maintain a design and development file for each medical device type or medical device family. This file is required to include or reference records generated to demonstrate conformity to the requirements for design and development and records for design and development changes. For more information about our institute and other training programs, you can contact us through email or phone. I sincerely thank you for all your interest and attention. Thanks and best wishes.